Hello and welcome. Today we're diving into the world of heart health to explore a condition called tricuspid regurgitation. We'll uncover what it is, why it happens, and how it's managed. Whether you're a healthcare professional, a student, or simply curious about your heart, this video aims to provide a clear and comprehensive overview. Tricuspid regurgitation occurs when the tricuspid valve, located between the heart's right atrium and right ventricle, doesn't close properly. This malfunction allows blood to leak backward from the right ventricle into the right atrium. There are many potential causes of tricuspid regurgitation. Functional tricuspid regurgitation is most common and arises secondary to other conditions like left-sided heart failure, pulmonary hypertension, or atrial fibrillation. These conditions cause the right ventricle to enlarge and distort the tricuspid valve annulus, preventing proper closure. Less frequently, tricuspid regurgitation can be caused by structural problems with the tricuspid valve itself. These structural problems can include congenital heart defects like Ebstein's anomaly, rheumatic heart disease which can damage the valve leaflets, infective endocarditis, certain medications or devices that directly affect the valve, or even trauma. Now let's discuss pathophysiology. The tricuspid valve is designed to prevent backflow of blood from the right ventricle to right atrium during ventricular systole. The leaflets of the tricuspid valve, anchored to the right ventricular wall via chorda tendineae and papillary muscles, ensure a one-way flow of blood when functioning normally. In tricuspid regurgitation, the incompetent valve allows blood to leak backward into the right atrium during each ventricular contraction. This backward flow increases the volume and pressure in the right atrium. Over time, the right atrium may dilate to accommodate the extra blood volume. Furthermore, the sustained increase in right atrial pressure can lead to back pressure in the venous system, resulting in systemic congestion. The right ventricle must also work harder to compensate for the regurgitant volume, potentially leading to right ventricular hypertrophy and eventually right ventricular failure if the condition persists untreated. Understanding how prevalent tricuspid regurgitation is can help put the condition into perspective. While exact figures are difficult to pinpoint, mild tricuspid regurgitation is actually quite common, often found incidentally during echocardiograms. Clinically significant tricuspid regurgitation, that is, cases requiring medical attention, are less common. The prevalence of tricuspid regurgitation rises with age and is more frequently seen in individuals with pre-existing heart conditions such as atrial fibrillation, heart failure, or pulmonary hypertension. The prevalence of tricuspid regurgitation is also higher in individuals with a history of intravenous drug use due to the risk of infective endocarditis. The signs and symptoms of tricuspid regurgitation can vary depending on the severity of the leak and how quickly it develops. Mild cases may not cause any noticeable symptoms at all. As the condition progresses, individuals may experience fatigue and weakness due to the heart working harder to pump blood. Shortness of breath, especially with exertion, is another common symptom. Peripheral edema, or swelling in the ankles and legs, can occur as fluid backs up into the venous system. Other symptoms can include ascites, or fluid accumulation in the abdomen, and an enlarged liver. Some patients may also experience palpitations or an irregular heartbeat. It is important to note that symptoms associated with the underlying condition causing the regurgitation may also be present, such as those related to heart failure or pulmonary hypertension. Diagnosing tricuspid regurgitation typically involves a combination of physical examination and diagnostic testing. During a physical exam, a doctor may listen for a heart murmur, which is an abnormal sound caused by the backflow of blood. An electrocardiogram, or ECG, can assess the heart's electrical activity and rhythm and help rule out other conditions. The cornerstone of diagnosis is an echocardiogram, which uses sound waves to create an image of the heart. An echocardiogram can visualize the tricuspid valve, assess the severity of the regurgitation, and evaluate the size and function of the right atrium and ventricle. In some cases, a transesophageal echocardiogram, or TE, may be performed to provide a more detailed view of the heart. Additional tests, such as a cardiac MRI or right heart catheterization, may be used to further evaluate the heart and pulmonary pressures. Tricuspid regurgitation can be classified according to its severity. It is typically graded as mild, moderate, or severe, based on echocardiographic findings such as the jet area of regurgitation, the vena contracta width, and the presence of right atrial and ventricular enlargement. Another way to classify tricuspid regurgitation is by its etiology, which can be primary or secondary. Primary tricuspid regurgitation refers to abnormalities of the tricuspid valve leaflets, chordae, or papillary muscles. Secondary or functional tricuspid regurgitation is more common and occurs as a result of right ventricular dilatation and/or pulmonary hypertension. This classification helps guide treatment strategies. It is important to note that treatment recommendations are based on symptom severity, disease progression, and overall patient health. Guidelines recommend intervention for severe tricuspid regurgitation, particularly if the patient is symptomatic. The treatment and management of tricuspid regurgitation depend on the severity of the condition and the presence of symptoms. In mild cases, regular monitoring with echocardiograms may be all that's needed. For more significant regurgitation, medications such as diuretics can help manage symptoms like swelling by reducing fluid buildup. If the tricuspid regurgitation is secondary to another condition, such as heart failure or pulmonary hypertension, addressing the underlying condition is crucial. In some cases, surgery or a transcatheter procedure to repair or replace the tricuspid valve may be necessary. Surgical options include tricuspid valve repair, which aims to preserve the patient's own valve, or tricuspid valve replacement with either a mechanical or bioprosthetic valve. Transcatheter tricuspid valve interventions are less invasive and involve placing a device to repair or replace the valve via catheter. The choice of treatment depends on the patient's overall health, the severity of the regurgitation, and the surgeon's expertise. While not all cases of tricuspid regurgitation are preventable, there are several strategies that can help reduce the risk. Preventing rheumatic fever through prompt treatment of strep throat infections can help prevent rheumatic heart disease, a cause of tricuspid regurgitation. Managing underlying conditions such as high blood pressure, heart failure, and pulmonary hypertension is also important. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can promote overall cardiovascular health. Individuals at high risk for infective endocarditis should follow recommended guidelines for antibiotic prophylaxis before certain medical or dental procedures. The prognosis for tricuspid regurgitation varies depending on the severity of the condition, the presence of symptoms, and the overall health of the individual. Mild tricuspid regurgitation often has a good prognosis and may not require treatment. However, severe tricuspid regurgitation can lead to significant complications, including right heart failure, and may require intervention. Recent research has focused on the development of less invasive transcatheter tricuspid valve repair and replacement techniques. These innovative approaches offer hope for patients who are not suitable candidates for traditional surgery. Additionally, ongoing studies are investigating the role of novel imaging techniques and biomarkers in improving the diagnosis and management of tricuspid regurgitation. Thank you for joining us on this exploration of tricuspid regurgitation.